Yes. Good morning. My name is Dr. Karen Cohen, and I'm the Chief Executive Officer of the Canadian Psychological Association, or CPA. CPA is the National Association for the Science, Practice, and Education of Psychology in Canada. There are about 18,000 psychologists registered to practice in Canada, which makes them the largest regulated specialized mental health care providers in the country, outnumbering psychiatrists about 4 to 1. Psychologists are Canada's premier mental health resource. Next week is Mental Health Week. It will also mark the one-year anniversary of the release of Canada's first mental health strategy by the Mental Health Commission. The societal cost of mental illness in Canada is estimated at $51 billion annually, with 1 in 5 of us experiencing a mental health problem or disorder in a given year, and with only about a third receiving the help they need. We have an issue of crisis proportions, a crisis that unfortunately remains all too silent. Canada's National Mental Health Strategy called for increased access to evidence-based psychotherapies by service providers qualified to deliver them. The strategy also recommends that we expand the role of primary health care in meeting mental health needs of Canadians. The Canadian Psychological Association could not agree more. One of the great challenges when it comes to caring for the mental health of Canadians is the significant barriers to accessing mental health services. We have evidence-based psychological treatments that work and experts trained to deliver them. However, wait lists for publicly funded services are long, and services provided in the private sector are unaffordable to people with low income or no insurance. There is no parity between mental and physical health care coverage in this country. The CPA, for its part, wanted to respond to the Mental Health Commission's call for better access to evidence-based care. Accordingly, we commissioned a report from a group of health economists to develop a business model for enhanced access to psychological services for Canadians. Today, we are very glad to release this report. The report, An Imperative for Change, Access to Psychological Services for Canada, follows from a review of national and international literature, as well as focused interviews and surveys of a range of stakeholders from among government, insurance, and health provider communities. This work provides a business case and proposes models for improved access to psychological services in Canada based on demonstrating positive return on investment for services that yield desired outcomes. The report rests on 2 well-established facts. First, there's wide agreement that we need to do a better job getting needed mental health care to Canadians. Second, research shows that psychological services are a cost and clinically effective way of providing this care. Canada has fallen behind. Other countries, such as the United Kingdom, Australia, the Netherlands, and Finland, have launched mental health initiatives which include covering the services of psychologists through public health systems, particularly in primary care. The United Kingdom has made marked investments so that evidence-based psychological therapies become accessible, and Australia has enhanced access to psychologists through its publicly funded health insurance plans. These initiatives are proving both cost and clinically effective. This report proposes and costs out 4 models that could be implemented and adapted to Canada's local needs and circumstances. The first is to adapt the UK's publicly funded model for improved access to psychological therapies in the provinces and territories. Under this program, psychologists and therapists deliver care for people with the most common mental health problems, namely depression and anxiety. Second, to integrate psychologists on primary care teams so that mental health problems are addressed at the right time, in the right place, by the right provider. Third, maintain and enhance the participation of psychologists on specialist care teams in secondary and tertiary care facilities where their services can enhance access to effective care and enhance health outcomes. And fourth, to expand private insurance coverage and promote employer support for psychological services. Canadian employers could expect to recover $6 to $7 billion annually, with attention to prevention, early identification, and treatment of mental health problems among their workforces. The provinces can act now and use this report to help create parity between mental and physical health care coverage in Canada. Provincial governments are concerned about their health human resource and the delivery of appropriate care that is both cost and clinically effective. When it comes to mental health, Canadian psychologists can help governments address this concern. Providing access to psychological services through primary care delivers effective mental health care to people where and when they need it. And in so doing, it frees up other healthcare providers like family physicians to attend to the general health and well-being of their patients. CPA also believes that the federal government has an important role to play in Canada's mental health. This role includes delivery of care in jurisdictions of its authority, health transfers to provinces and territories, and collaborating with provinces and territories in developing innovations in health promotion, illness prevention, and healthcare delivery. In addition, as a large employer, the federal government can lead by example in promoting psychologically healthy workplaces and in providing meaningful mental health coverage through its insured extended healthcare plans for employees who need it. It's time to take up the recommendations of the Mental Health Commission's national strategy. It's time to create parity between mental and physical health coverage for Canadians. Enhancing access to psychological services can help respond to that call and help Canada do a better job for our country's mental health. Thank you.